Okay. Theo Nagadagwu Ayadeha. Julie Seward Deguado Gale Iliga Ahani Ojedaha. Hello, everyone. My name is Julie Seward, and I'm overjoyed that we've all come together today. Happy New Year. Welcome to the first R&R, or Reflect and Regroup with Known, for the year. I'm excited to have such a good turnout and exciting to see some new faces. So, hey, Parrish, good to see you. Okay, next slides, Alex. So the purpose of today's call, and really the purpose of our R&R calls, is to really kind of celebrate and reflect on what we've done typically in the quarters. We have these every quarter, especially since we have some new people. We'll kind of explain kind of what the R&Rs are about. So we typically have these every quarter, and it's really just to kind of take a pause to again celebrate our accomplishments and everyone's accomplishments for the quarter, and to kind of pause and then and to regroup for work in the next quarter, and to share out. So for today's Reflect and Regroup, what we want to do is really kind of take a look at our accomplishments in 2022. So Alex, which is our epidemiologist for Known, has kind of put together a annual evaluation that she's going to go over today. So we're going to celebrate those accomplishments. We'll talk a little bit about our goals for 2023, and then obviously every time we have one of these is to provide an opportunity to get feedback from you all, to share ideas and connect. I'm going to go over just a quick, since we do have some new people, just briefly an intro to the Native Oral Health Network and kind of our structure. So we are, the Native Oral Health Network is a program that's housed at the Southern Plains Tribal Health Board, Oklahoma Area Tribal Epidemiology Center. So SPTHB is a nonprofit organization that's based in Oklahoma City, Oklahoma. The health board was established in 1972 to provide a unified voice on tribal public health needs and policy for the 44 federally recognized tribes and the states of Kansas, Oklahoma, and Texas. Known's mission is to build healthier Native communities by connecting oral health to overall health and wellness. And we do that through peer support, collaboration, and community engagement. So since Known's inception in 2017, we've grown to roughly 160 members. Alex will go over that later. Nationwide, we work with other Indian health boards, tribal epidemiology centers, Indian Health Service Dental Support Center, dental support centers, and other public health partners to advance oral health equity for American Indian, Alaska Native populations. Okay, next slide. So our staff, our team, through the Native Oral Health Network and all of our activities, myself, Oral Health Programs Manager, and then I get the privilege to work alongside Alex Holt, which is our epidemiologist, and Amanda Ianiza, who is a PhD candidate at the Department of Epidemiology and Biostatistics at University of Oklahoma. And let's see, Alex, I'll kind of take this intro, and then I'm going to hand it off to you once we get to the evaluation. So perfect. I'm super excited to announce our new additions to the Known core team. Our core team, or our steering committee, is really exists to help, again, kind of steer Known and provide input, help connect to other partners in this work to increase our capacity and ability to support one another. So I'm so excited to welcome Dr. Tamana Begay to our core group. Leandra Beach, she is from Alaska Native Tribal Health Consortium. Dr. Begay is from the Gallup Indian Medical Center. Leon Roberts with the United South and Eastern Tribes. Mary Altenberg, who is with the Society of American Indian Dentists, and Dr. Jandra Korb, which is DentaQuest and Society of American Indian Dentists as well. So we're so great to have you. I think we have some of you all on the call today. So so thanks so much for being willing to be a part of our group and to help continue to grow our network and our coalition. So, okay, next slide. And then I want to go ahead and recognize our established members and also thank them for their support to Monica McKee, which is with the Oklahoma City Indian Clinic, Dr. Miranda Davis, Native Dental Therapy Initiative Director. Hey, Miranda, I see you on here. Good to see you. Tycee, who's on here as well. The Northwest Tribal Dental Support Center Director. Allie, who is on here as well. Albuquerque Area Dental Support Center Director. And I think we have one more slide of these. Yes, Jamie Rowell with the Absentee Shawnee Tribe here in Oklahoma. Candace Williams, she is with the Lawton Indian Hospital, which is a southwestern part of the state, and Keisha Myrick, Oklahoma City Area Dental Support Center Director. So again, many thanks to you all for your service and support. Okay.
All right.
Next slide. Yes, take it away, Alex. Thank you.
Okay, so can you guys hear me okay? Okay, perfect. My computer has been kind of lagging, so I may have to stop my video at some point. But so as Julie said, we're going to take a look at 2022 and how we've grown and the things that we have done. If you give me just a second, I need to go give my baby his bottle. He just woke up.
While she's doing that, I'll kind of explain a little bit about what we do every year. We just we have different measures and let me explain a little bit further. The Native Oral Health Network is funded by a few different funding streams, and so from those grants and deliverables, we've created these measures which inform our annual evaluation every year. And this is something that we're also building and growing as well. So every year it kind of looks a little bit different in terms of different measures and things that we're reporting on. Okay, Alex, take it away.
Okay, sorry about that.
That's okay.
Yes, so this is kind of what we're looking at this year, but like Julie said, it changes year to year just from the different activities that we do and things like that. So we'll look at membership first. As of December 2022, we have 162 members. We've gotten 25 new members since January 2022. And our membership represents, we kind of take into account different measures. So where they're located, the organizations that they are a part of, what their expertise is. So we've got anywhere from dentists to public health officials to dental hygienists, people working in the public sector, the private sector, things like that. So right now we have 65 different organizations represented in our membership. We have 58 different types of expertise. We're across 19 states in 2 countries. We have one member from Canada. So we've officially gone international. So that's exciting. So one of our big accomplishments of 2022 was creating our own website. So this is our official Native Oral Health Network website. This is where all of our projects, all of our R&R recordings, anything that we have produced or things like that, updates. We have a calendar, so you can check out different events that are going on, like conferences, things like that. Everything will be housed on our website. And we have updated our charter and created a new strategic plan for 2022 through 2025. So that those documents also live on our website, so feel free to check them out under the resources tab. And so we really focused this year on writing projects and looking at data collection. So our community health aid program, tribal, I can't remember what CHAP's full.
Yeah, it's the Community Health Aid Program Tribal Assessment and Planning Grant. And just for just a really brief overview of what that is and what we're doing is the CHAP program originated in Alaska. It's a multidisciplinary system of healthcare delivery and training. It originated in Alaska. It is in the process of expansion to lower 48 states. And so I am the program manager of that grant. And so we are this survey was to examine access to care, preventative services that are happening. So essentially what we're doing is a feasibility study to see if tribes are interested in how we can support them in integrating the community health aid program. There is a dental component of that program, which is why we're talking about it here.
Perfect. Yeah. So Julie's kind of gone over the community survey that was disseminated at the Pawnee Nation Health Fair. There was 48 people that were surveyed. And then along with that, the CHAP program has been working closely with Pawnee Nation. They have conducted focus groups with Pawnee Nation doing SWOT analysis. And they did that to kind of understand what the infrastructure there was for the CHAP program, which it also includes dental therapy, dental health aid therapists. So that's kind of what CHAP has done in the last year, which is great. And then another project that we had was a systematic literature review on the American Indian Alaska Native representation in the oral health workforce. And we are pleased to announce that that has been accepted for publication in the Journal of Racial and Ethnic Disparities. So we're very excited about that. We're currently conducting another literature review on the American Indian Alaska Native misclassification and cancer data, looking at how misclassification can skew public health data that we can get from the CDC and things like that. And we are in the beginning phases of that. We'll be doing our full text analysis later this month. And then another publication that we had this year was the Oklahoma Oral Health Policy Brief, was published in the Frontiers of Oral Health academic journal. And there's been a little over 1,300 views since March of 2022. I don't know why this is not, okay. We have also done several presentations and trainings. So our major resource publication of this year was Expanding the Oral Health Workforce, a Dental Therapy Toolkit for Oklahoma. You can find this toolkit on our website. And then we have done 7 presentations and 6 trainings over the course of the year. Let's see. I thought I put in my notes. I can't see right now where those presentations were. I know that there were a few at the Tribal Public Health Conference, which is hosted by Southern Plains Tribal Health Board. There was also presentations with the Oral Health Progress and Equity Network and the Southern Plains Tribal Health Board's annual training summit. let's see. Okay. So now it's time for our reflection. What are some oral health data or other projects that you'd like to see explore in the next year? Feel free to put them in the chat for discussion, or you can shoot them over to me in an email. We love to, work for the group. So if you have anything specific that you'd like to see us do, feel free to let us know. Okay.
Oh, sorry, Alex, really quick. I do want to mention, and we'll talk a little bit about it in our 2023 goals, but we're actually kind of getting into more of the racial misclassification work. We're partnering internally with some of our other programs. This work is initially the systematic literature review is being funded by CareQuest Institute. And so we're partnering with them on the literature review, but it is part of a larger scale project and trajectory that we want to go on. And so I know it's kind of hard to think of, especially, we work within the Tribal Epidemiology Center, we're, working and interacting with a bunch of EPIs and biostats. And so sometimes that language and conversation is just kind of comes naturally, and it's really good to, it's easy for us to kind of figure out, not being a data person myself, to kind of leverage different opportunities. So again, there's a bunch of different projects and things that we want to do, but if there's anything specific that you've seen done, or you see a need or gap, like Alex said, please put it in the chat or reach out to us, because also it helps to hear from you all and other things that you guys are seeing. Okay, thanks, Alex.
Yeah, no problem. Okay. So we've also had some outreach efforts in the last year.
Hey, Alexandria,
Yes.
I had my hand up before you.
Oh, sorry, I can't.
I had a comment or something, or suggestion about the last screen about something you'd like to see. I don't know if it's something I'd like to see, but something I'd like to know is we provide. I'm Tycee Mason. I'm the director of the Northwest Tribal Dental Support Center. Chela Wiki. Hello, everyone. Before I just start rambling on, sorry about that. We have new people. We send out an annual needs assessment every year to our dental programs, and we find out what our dental programs need. And it's not always clinical based. It's not always, it's a lot more of the team building, conflict resolution, and a lot of stuff that really help a dental program be their best. So I'm interested in knowing in the other areas if they do that and what they're finding from their dental programs, because that's what we base our CDE topics on, and ways that we support our dental programs is based on that needs assessment. And oftentimes every single needs assessment, and I've been at the Dental Support Center this year 19 years, it's always working in Indian country. It's always something along conflict resolution and team building, and not always, infection controls on there as well. And there's other things, but it's always been those. And so I'm wondering what other areas are finding with their dental programs and what they're doing to provide support to that. So I just find it really interesting. A lot of our dental programs always want to know more about working in Indian country. And I love that, being a tribal person myself. So they're super curious and they're super interested. So just there, I think that that's really important to know when you work for tribal, dental programs or IHS or wherever you may be, is it's working in Indian country, and oral health is a treaty right. And I'm so passionate about everyone knowing that it's not free.
Right.
It's paid for by ceded land. And I love that our dental programs want to know just more and more. So super curious about other areas.
Yeah.
So if we could just, Tycee, to kind of help facilitate your question and request, if you all would email Alex anything that you want to share specifically about what you're doing in your areas, and we can share out with the notes and the recording and share out to everybody on the call in case it's helpful for everyone. You can also put it in the chat, because we can also share everything that's any questions or feedback or information we can share through the chat, through the notes as a follow-up to the meeting.
Yeah, so if you guys want to email that information, I can compile everything into a group memory and send it out to everyone after the meeting.
Ticey, would that be helpful?
Yeah, I can also send you what our needs were.
Okay.
I don't think it's confidential because we present on it. I could also send you in our area what
Yeah.
last year was in this year or 20. Is someone's smoke alarm going off, or is it
Yeah,
mine?
it's mine. No, it's
okay.
mine.
I was like, if it's mine, it's going to drive me crazy all day.
Sorry.
It's okay. I can hear everything. My kids hate it. It's just it's super helpful to be able to assess that and see where our dental programs, needs lie. So I can send you those results as well if you're curious.
Yeah, that'd be really great. We'll get into kind of our future projects that we have outlined for 2023. And I think that would be kind of interesting to look at as a future project for Known, is looking at those community needs assessments through the clinics. Okay, so our outreach for 2022 was we produced a video kind of showing who Known is and what we do. That video is available on our webpage, but it was also aired through Good Health TV. And I don't have the dates of the airing on hand right now, but you can see the video when you go. I think it should be the first resource on our resource tab. We've also, through the CHAP grant, hosted 5 interviews with tribal leaders and stakeholders. Again, kind of assessing community health aid program and feasibility in our tribal communities. So partnerships. We have 7 new partnerships. Grass House LLC is through the Wichita and affiliated tribes, Iowa Nation, Pawnee Nation, Meharry Medical College, University of Buffalo, and Seneca Nation, the Oklahoma Policy Institute, and the Oklahoma State Department of Health.
Hey, Alex, could you go back to the slide? Yeah. Just talk a little bit about, because this year was something new that we did, or I guess last year was actually providing some funding for the community through the subawards with Grass House LLC, Iowa Nation, and
so
POTO. So could you just briefly talk a little bit about each one of these initiatives really?
Yeah, so I thought there was another slide, but there wasn't. So the Oklahoma State Department of Health and Southern Plains Tribal Health Board partnered to provide some subawards to organizations in Oklahoma serving tribal communities. So Grass House LLC, again with the Wichita and affiliated tribes, are providing, I think it was 10 $3,000 scholarships to tribal students going to into the health field, and I think the majority of them are looking at medical school or nursing school, and Grass House in their application kind of use it as a way to gauge, interest in oral health if they're going into the medical field, if not, specifically in the dental or hygienist route. kind of helping to bridge that medical and dental gap that we see. And I believe that application for the scholarship has just been open. So we'll be excited to see, the students that are interested in medical and dental going forward. Then with Iowa Nation, so Iowa Nation, their SEB award is mainly focused on bringing care to their patients through additional operatories. I think one additional operatory in their clinic, purchasing a no-bad x-ray machine, and just kind of generally building up their clinic. It's the Perkins Family Clinic out in Perkins, Oklahoma. There are two other organizations. Oklahoma City Indian Clinic is doing something similar as Iowa Nation. So they're focused on bringing care to their patients through a variety of different ways. So they're using their funds to purchase another Nomad X-ray machine. That way they can actually go to primary care appointments. So when patients are there for annual checkups or things like that, a dental professional can come in and do an oral health assessment as well. That way they kind of knock out two birds with one stone. One appointment, you can get a screening from your dentist, and also get a health checkup from your physician. And then they're also looking at recruitment through the OU Dental School of Dentistry, and hosting information sessions for current students who are preparing to enter the workforce. The other organization, I guess, is technically in 2023. They were funded in 2023, but it's Poteau Valley Improvement Authority. So this Improvement Authority, they are looking to fluoridate their water, their community water system. And I don't have my notes pulled up with exactly how many residents they are serving, but a good portion of that are native families. So they are going to purchase some fluoridation equipment to help fluoridate the water for the next year. So we're really excited to see these organizations and the good work that they're doing with the SEB awards, and hopefully in the summer we'll be able to give kind of some updates on the progress that they had made, and just excited to see oral health becoming a priority in Indian country for sure. All right, so upcoming projects for 2023. So we are going to conduct a full assessment of Known's effectiveness on structure and value for our members. This will be conducted as a focus group. We're hoping to do it during the Tribal Public Health Conference. It may also be virtual. So more information on that will come. And this is just kind of to help guide Known and make any improvements to the structure, the way that we conduct our meetings, projects that we're focusing on, things like that. And more information for that will come probably at our next R&R on whether or not that's going to be virtual or in person. We are also going to conduct a community needs assessment to assess the socioeconomic factors that impede access to care for Native community members in the IHS OKC area. So this is going to be Oklahoma, Kansas, and Texas, this needs assessment. When we finish creating the needs assessment, we can share that tool for others if they are interested in conducting a similar needs assessment for their area. I'm pretty excited to conduct this and share the information at one of our later R&Rs of this year. And again, we are going to complete and publish our racial misclassification literature review. This will be done, completed in the summer of 2023 and hopefully be published by the end of the year. And then let's see. Okay, so we're at our.
Hey, Alex, really quick. We go back to the previous slide. I just wanted to talk a little bit about, I mentioned earlier about racial misclassification and some of the projects that NOAN will be focusing on for 2023 and hopefully beyond. But we're hoping that this is really the phase one of 3 or even additional phases for this work. And kind of the vision for this project came from, and I know Tyce, me and you have talked about this. We've talked about this in our core meetings, but how data is really, and I don't know if you all have heard Abigail Echohawk talk about structural racism in data, and if you haven't, I actually will share the link to her presentation that she did through the CDC. I believe it was late last year, but this has all come from a lot of what she talks about and seeing in American Indian, Alaska Native oral health data not being reported, and essentially another way that American Indians and Alaska Natives are being erased and not, the data is another vehicle of that structural racism. And so it's Abigail she talks so fluently about it and really puts it in a really great perspective. But again, Tyce and some of our core members have said, after having discussions and questions with national organizations, federal entities of, why are you not presenting American Indian, Alaska Native data? What's going on? So it behooved us to take a deeper dive into these data collection processes, reporting processes, and to kind of take a deeper dive and to analyze that, to be able to share obviously with our members and the general public about how we can go about fixing this and getting our data represented and getting our stories told. So anyways, I wanted to give you all a little bit more perspective on that project. Again, this will start with our literature review. What we'd like to do for phase 2 and phase 3 is to develop a case study to be able to show and demonstrate exactly how some of these processes happen, that also display some of the gaps and bring awareness to that, and hopefully initiate some reform on how these practices are conducted. And then we also would like to create some resources for the community to help bring awareness to these practices and to empower them to have the voice on how the data how their data is collected and to improve the process starting in the community. So that's a little bit about what we want to do for 2023 and beyond.
Can I add to that, Julie?
Yes, please.
I would also like to encourage everyone on here, when you're in any kind of meetings and you're noticing that AI and data is not represented, ask why. And if they say it's not available, ask where they looked. And then sometimes you will find out they haven't and they're just saying it's not available, and it is. And then provide some resources where they can look. It's putting that back into their responsibility to look for this and stop dismissing us or categorizing us as other. because it's personally and professionally very offensive. That's what I've been doing. And I strongly encourage other people because, you know, all together we can help this, you know.
Thanks, Tycee.
All right. Okay. So that is kind of the end of the 2022 year. Sorry. So again, you know, what gaps do you see that we can help fill? Do you have any thoughts or questions about any of our 2023 projects? If you have any creative ideas on how to promote the resources that we've already created, feel free to put that in the chat or email me. And if anyone, you know, if you see a project that you would like to collaborate on, or would like to partner with us on any projects that you have, let us know. We're excited to work with everyone in varying capacities and things like that. So important dates. Our next R&R will be March 2nd at 11 a.m. Central Time. This will be the R&R before our conference in April. Our conference is going to be in Durant, Oklahoma. I believe registration is open, and we will put the link to that in the chat if you're interested in coming. And I believe that is it. So if you're new and you want to get our monthly newsletters and keep in touch with us, you can fill out this form. You'll be added to our monthly newsletter. And if you're interested in oral health advocacy on a national level, the Oral Health Progress and Equity Network is a great place to find you know, people working in your area or your interest. And then we also have Facebook and Twitter. So be sure to follow us on those platforms. And then, I think number 4 was actually an old bullet. We will have a post-meeting evaluation that I will put in the chat whenever I stop screen sharing. So,
Thanks, Alex. I want to go back. I know we have a few minutes left, and I want to go back to the Reflect slide, and you don't have to show the slide, but I just want to go back to those questions in case. I know we have a smaller group, so if anyone wants to unmute, if you all have any questions or any feedback, any suggestions, feel free to unmute or put those in the chat. But I know it was kind of a lot of information in a short amount of time with not a lot of detail, but we're happy to answer any questions and hear from you all. It's good to see some familiar faces and names.
I have a couple. Go ahead.
Go ahead, Miranda.
Might not be of interest to everybody, but just in case, I have a couple of fun announcements that I think are fun. So one is that coming up in a little bit today, an hour or something, HRSA Region 10 is having a webinar about tunnel therapy that I think would be interesting to watch. I think so because I'm one of the presenters, but also hot off the press is a piece of news that I think is pretty exciting about dental and oral health equity, and that is that Washington State has for a few years had a state plan amendment in going through the courts about reimbursement for dental therapy for services provided by dental therapists. And it had a ruling, and the ruling was overturned, and then the ruling was petition and all these extra steps, and it went through the Ninth Circuit Court of Appeals. And we just like 5 minutes ago found out that it was ruled in our favor at the Ninth Circuit Court of Appeals that dental therapist services can be reimbursed in Washington State. So that's pretty exciting.
Hey, that's super exciting. Thank you so much for sharing. That's really good news.
Yeah, it was a big deal.
Do you have anything, do you have any like document or email or anything that you can share that we could add to the?
Soon, not yet.
okay.
I just got the text.
Oh,
so I don't
text.
even have
Okay.
it yet.
Okay.
So hopefully soon we'll have lots of good stuff to be able to share.
Okay, great. And I'm glad you brought that up, because I also wanted to touch a little bit on our dental therapy advocacy that we're doing in Oklahoma too through Known. We have we're working with the National Indian Health Board on a education and outreach grant. Miranda's part of our working group. We're now in year 3 of that work, which one of the main deliverables for that was our expanding access to oral, I can't even remember what it's called, expanding access to oral health care, dental therapy in Oklahoma, our toolkit that we created, that we're just now kind of starting the promotion on. And Miranda was, like I said, on our working group for that. We're really excited to announce, this is somewhat new, but we're excited to announce that the American Dental Therapy Association will be hosting their annual conference here in Oklahoma. And the Southern Plains Tribal Health Board will be working with them to plan that event. So that will happen in October, I think, October, end of September. So we're really excited to be able to partner with them on that. We are working with Oklahoma Policy Institute on developing some different strategies and outreach in kind of some coalition building in Oklahoma to be able to advocate for dental therapy, especially as the community health aid program is expanding. So there's a lot going on, and it's exciting to be able to be a part of that and to be able to work on dental therapy advocacy here in Oklahoma. So.
Oh, this is.
Oh, sorry, Leon, go ahead.
I just was wondering, are we gonna have access to these slides? I know that last slide, it had some links and
Yes.
and you were saying something about putting, oh, I haven't checked the chat to see about the link for the conference in Durant.
Yes, I will post the registration link for the conference in the chat, but you will have the slides available after this meeting.
Awesome, thank you.
All right, anything else? All right. Yeah, at our conference, which I do believe is a hybrid conference, we'll be kind of going over in detail of our toolkit, and we'll have some some guest speakers there to talk about that. And then also we'll be presenting on our community health aid program activities. We've developed a working group with the Oklahoma Healthcare Authority, which is our Medicaid administrator, and trying to figure out kind of what state policy implications will exist for us with the CHAP expansion, obviously including dental health aid and dental health aid therapists and those things. So that's all happening too. So a lot of good things going on.
Hey, Julie, I'm
Yeah.
not sure how many people on here attend or either the dental programs in our area, the National IHS Updates meeting, but I'm on the planning committee again, and the dates are supposed to be in April, May, or June. We're unsure. And it's probably going to be in Nashville, Tennessee, but it hasn't been official. I just wanted to give people a heads up. Until the dates are secured, it's kind of hard because there's so many conferences going on, and we're in the the planning stages for the Portland area dental meeting in August. So we're trying not to have it too back to back. So I just wanted to give everyone the heads up with that. It's a really good conference for people
Ticey,
to
do you have
attend.
the, well, I think oh, sorry. Ticey, do you have the dates? Did you say the dates have not been set for updates yet? Okay.
Not even the month. That's why I'm saying it's been really hard. I'm a planner in advance,
Yeah.
and we don't have them yet, but I can let you know, Julie, as soon as I know. You can share it with everyone. There
Okay.
is going to be a dental health aid track. There's dental hygienist, dental assistant. So it's a really good time to meet other programs, networking, seeing what's going on. So I just want to encourage people to keep your eyes and ears open for that one as well.
Okay, will do. Yeah, anything that, any information you get, Ticey, feed it my way and we'll put it out in our newsletter. Okay. All right. Well, if there's nothing else, thank you all for being here. Thanks for your attention. And again, if there's, if you'll fill out the post a meeting evaluation, should be an opportunity for you all to provide any feedback and what we're doing good, what we need to do better at moving forward in other projects. So we're always looking for that feedback. So please send it our way. You all have a great rest of the day and weekend, and we'll see some of you guys this afternoon on the HRSA webinar. Good luck, Miranda. Looking forward to hearing from you.
Thank you, everybody.
Take care, everyone. Thank you.
Bye.